So welcome back to the Gallbladder Diet Podcast. I'm so excited for today's episode because I have someone very special on today's podcast episode, and her name is Mia, and Mia is a nutritionist that helps me with all things post-gallbladder surgery care. So what we're going to do for today's episode is answer some commonly asked questions about post-gallbladder surgery care. And I actually took these questions. I took a poll from the community on Instagram. If we're not connected on Instagram, connect with me there. It's gallbladder.nutritionist. But I tend to do weekly Q&As. So I asked the community, what are some questions you'd like us to focus on this podcast? And I'm going to bring Mia on, and we're just going to chat all things post-gallbladder surgery care. So that's what today's episode is about. So welcome, Mia.
Hi, Olivia. Excited to be here.
Happy to have you. Can you just quickly give a quick introduction about yourself?
Yeah, so I am a nutritionist, like you mentioned. I'm technically a certified nutritional practitioner, and I specialize in my practice in like IBS and digestive health, and absolutely gallbladder, liver health is a big part of that. So I do have a lot of experience and see a lot of clients, like you mentioned, primarily in the post-op stage of their life, I guess. So yeah, I primarily work like one-on-one with clients, and that's my area of specialty. Big in perks. I have a pretty comprehensive history with gut issues myself that I've been able to completely transform and heal from. So yeah, excited to be here.
Yes. Thank you, Mia. Yeah, Mia is a huge blessing on the Gallbladder Diet Team. She's helped me a lot this year, and it's been a pleasure having her help me with clients as well. So we're going to break down today's podcast based off questions around digestive gut health, then some questions around metabolic health, and we'll wrap up with some common questions about what we should eat, should we avoid, how to support the liver. So, of course, I'll always leave you with actionable tips. So that's what we're going to cover on today's podcast. So first things first, let's just chat about bowel changes post-gallbladder surgery. I think most people kind of fluctuate between constipation or diarrhea, and sometimes it can be the extreme constipation or diarrhea, or sometimes it's a fluctuation of both. And we know that gallbladder surgery changes the physiology of our digestion, specifically around bile. And bile is really important to help ensure that we have nice bowels, basically. It also helps protect a healthy gut, which is important for keeping our bowels regulated and nice and healthy. So sometimes what can happen post-gallbladder surgery is you get two extremes. One is that the loss of the concentrated bile, because we no longer have our gallbladder there, which is our storage tank for bile. So it's no longer there. And so what can happen in this situation is that there's a loss of bile there when we go to eat our meals, fattier meals. And this, you'll see a scenario where people start to get constipated, a lot of bloating after meals. They may start to struggle with like detox issues, chemical sensitivities, because we're not releasing out through our main form of detox, through our stool. Or we get the other end of the spectrum where all of a sudden we release a ton of bile at once, and this is going to cause more diarrhea type symptoms or maybe bile reflux type symptoms. So certainly we can go either way, or sometimes there's fluctuations of both. And keep in mind that, our bowels are a good indication of our health. And this is one of the number one things I think we typically work on with people post-gallbladder surgery is how can we get these bowels regulated as much as possible? And there's a lot you can actually do. So there's a lot when we look at why someone's dealing with bowel changes, but at the foundation, we need to make sure that we're working on the controllable factors, right? Within our diet, our lifestyle, our eating habits. But then second is our digestion. So when we look at the fluctuations of constipation, diarrhea, typically we have to work on optimizing digestion. So working on the bile and stomach acid and enzymes. So that's typically where I start with people when they do have these fluctuations of bowels. Mia, what do you think typically see that could be contributing to some of these bowel fluctuations too post-surgery.
Yeah, well, I'm with you on like it seems to be either end of the spectrum for people, unfortunately. And with the bile dumping picture, or if you are listening to this and you experienced a loose stool urgency diarrhea after getting your gallbladder removed, a lot of people go to introducing bile salts and ox bile, right? As like I feel like as soon as you get your gallbladder removed or you know that you have gallbladder issues, if you're like listening to podcasts, consuming content, reading blog posts, you'll likely have come across that ox bile and TEDCA, our bile salts are great solutions for you. And a lot of people experience actually worse bile dumping off the back of taking ox bile. So if that's you, just know that there's like options and this is likely what's happening for you. And it's kind of like adding fuel to the fire. I just felt like I needed to add that in there. But yeah, I mean, so aside from bile definitely playing a role in either like the constipation or loose stool diarrhea picture, microbial populations and how that changes too off the back of gallbladder surgery can definitely play a role in bowel movements, right? So I know today we're going to talk about SIBO and different imbalances in the microbiome that can happen off the back of surgery, or even just like poor bile function in general, poor bile flow in general. But definitely things like SIBO and other microbial imbalances and infections can impact bowel movements too. So sometimes it can be a combination of things.
Yeah. Certainly. And I think we can segue into SIBO because a lot of people asked about this. And SIBO, small intestinal bacteria overgrowth, is actually very common post-gallbladder surgery. There's a lot of research that shows like it's more than 40% will end up getting SIBO at some point post-gallbladder surgery. Sometimes it's the reason for post-cholecystectomy syndrome. So when you're dealing with chronic symptoms, chronic bile acid diarrhea, bile reflux, gastritis, a lot of histamine issues, chemical sensitivities, like just a lot of intense bloating like you're 6 months pregnant, a lot of food intolerances, fiber intolerances. Certainly, I think SIBO is worth looking at. It's typically one of those, there's many factors that could be causing some of these chronic GI symptoms, but it's kind of the first one that I always look at with people post-gallbladder surgery, just because it's so common. So, Mia, can you tell us a little bit more about SIBO?
Yeah, so as you mentioned, SIBO is an acronym that stands for small intestine bacterial overgrowth. And I guess what's important if you're listening to this for you to know about the microbiome is that, and I guess like our GI tract, is that the majority of our gut microbiome actually lives in our colon, so our large intestine. In our small intestine, we do have some microbial populations, but they are quite minimal compared to what we have in our large intestine. Our small intestine is where we digest and absorb the majority of our nutrients. So that's like the main purpose of our small intestine. So you can imagine if we have overgrowth of bacteria here, these bacteria have access to all of the, or potentially undigested food that's hanging out in the small intestine, which allows these populations to grow and proliferate. And a big part of the, I guess, like, these bacteria, they basically like ferment the fiber and the food products that are in the small intestine and create gas as a byproduct. So that's where we get a lot of those changes in symptoms and bowel movements and bloating, especially as like a really hallmark symptom of SIBO. So it's kind of like the logistics of what's happening. And with gallbladder removal, when we don't have that concentrated bile, bile has natural like antimicrobial properties to it. So part of its role is to help kind of keep microbial populations at bay in the small intestine. So without access to that, we become more susceptible to SIBO. There's definitely other root causes, and it's, I think you would agree with this, Olivia, but it's very common that we see many factors playing a role in symptom presentations. And there's even things like chronic stress can be a big driver of SIBO, but chronic stress can also have a really big impact on our liver and gallbladder. So it can be part of that picture too. Same thing with things like hypothyroidism, where there's a big connection between poor thyroid function, gallbladder function, SIBO. So it's often multifactorial, but definitely really common. We see it in a lot of our clients. And yeah, I guess like with SIBO, it's important to address it. Like, there's definitely means of testing for it. Figuring out what type of SIBO you have can be important. There's 3 main types. There's methane, hydrogen, and hydrogen sulfide SIBOs. So it's important to get testing done if possible to know, what we're dealing with. And then getting rid of it is important, but also trying to prevent it, right? So addressing the root cause of why SIBO's occurring in the first place is a really important piece, especially because it's so prevalent and the recurrence rate of SIBO is really, really common for people. So that kind of like root cause, addressing why it's happening piece is really, really important.
Yeah, and it's really important to know if you've had your gallbladder moved before doing any type of SIBO eradication protocol, and we'll talk about typically what the forms of treatment are. It's really important that since you don't have your gallbladder anymore, you work on your digestive function. So we see this all the time with people post-gallbladder surgery that are either put on antibiotics or antimicrobials before addressing their digestive function, maybe even supporting their liver, really optimizing that bile flow. And this is a big problem because then these individuals are often stuck on multiple rounds of antibiotics, multiple rounds of antimicrobials, and it's very hard to kill off SIBO if your digestion is weak. And so for anyone post-gallbladder surgery listening to this podcast and you suspect SIBO or you have SIBO, it is really important you go through some foundational steps and you work on your digestive function before jumping into any eradication protocol, or else there's a high chance you're going to be on multiple rounds of antibiotics or multiple rounds of antimicrobials. And when we talk about digestive function, to kill off SIBO before doing any type of SIBO protocol, you really do need to work on optimizing your bile because, as Mia mentioned, bile is a form of antimicrobial. It protects your small intestine. So if you go in to antibiotics or antimicrobials without supporting bile flow, which starts in your liver, working on your ileocecal valve, different sphincters, then in your digestive tract, it's going to be very hard to rebalance it. And then certainly we also need stomach acid. Stomach acid also helps fight off digestion. And many people post-gallbladder surgery, even with gallbladder issues before, tend to have low stomach acid. And we know this because stomach acid is your conductor of your digestion. And typically you need adequate stomach acid to release out bile. So please, anyone that is listening to this that suspects SIBO and you are post-gallbladder surgery, it's important you work with experts that understand this. And I see it all the time. And I work with both me and I work with a lot of people post-gallbladder surgery care that are stuck on SIBO protocols quite often, or they're put on antibiotics, antimicrobials, and it makes them very, very sick. So just want to put that out there for anyone listening. And a common thing post-gallbladder surgery too with people with SIBO is an issue with histamine excess. And so SIBO can often drive excess histamines. It will basically it'll ferment the different foods, your resistant starches, your FODMAPs, and anytime it ferments those, it'll cause an excess of histamines. And then also, SIBO can deconjugate bile acids, and this can trigger an excess of histamine. So anyone that has tried ox bile and you notice an increase in histamine symptoms, itchy skin, diarrhea, just feeling unwell, stomach upset, these can be signs that you have histamine excess going on, which is actually extremely common without a gallbladder. And SIBO is a big driver of that. So in a case of where we have excess histamines going on and SIBO, again, jumping into an eradication protocol with antibiotics or antimicrobials tends to make people very sick. So you have to go through critical steps to bring down the histamines first, work on your digestive function, make sure your diet, lifestyle habits are dialed in, then tackle the SIBO. So typically for most people post-gallbladder surgery with SIBO, I usually say it's like a 6-month process if you want to do it right. So these are just common things that I typically see with people post-surgery. And a big thing too with SIBO is that, there's an issue too with individuals post-gallbladder surgery that really struggle with methylation. And most people with history of gallbladder liver issues have methylation problems. And SIBO can affect that quite significantly, because if SIBO's there, we aren't getting our adequate nutrients like B12, folate, and things that are needed for proper methylation to occur. So again, when methylation happens, or when we're not methylating well post-gallbladder surgery, this is also going to drive more histamine issues. So if you're, listening to this podcast and you're like, I'm sensitive to everything from supplements to medications to chemical sensitivities, there's obviously a lot of stress going on in the GI tract, and we're liver, and we're struggling to methylate well. And this is causing increased histamine. So just be mindful about that as you're navigating SIBO or some of these more chronic issues post-gallbladder surgery. So Mia, do you want to talk about, so people understand, let's say we suspect SIBO again. So what are kind of the common signs and symptoms of SIBO? I recapped this a little bit in the beginning, but let's talk about that. And then what are some of the typical steps we take if we suspect SIBO is present?
Mm-hmm. Usually with SIBO, there's definitely like a cluster of digestive symptoms that people will experience. And then there's also symptoms outside of the GI tract that people can experience as well if they have SIBO. And that's due to how, like our digestive system, especially via intestinal permeability or leaky gut, as it relates to SIBO, can have an impact elsewhere in the body. But I always go to like altered bowel movements. There's different types of SIBO can impact the bowels differently. So we can see constipation, we can see diarrhea, loose stool urgency, or we can see a mixture of both. Bloating is a really, really big one, especially the distension that you mentioned earlier, Olivia, where people, and I hear this all the time, where clients tell us, they're like, I look like I'm 8 months pregnant. Like, I'm so bloated and distended, I can't button up my jeans. Like that kind of bloating, especially bloating, within an hour-ish, hour and a half after eating. Acid reflux, gastritis type symptoms can be related back to this. Histamine symptoms, like you mentioned. We can even start to see like cognitive issues, joint issues, skin concerns as it relates to SIBO. Nutrient deficiencies, like you said, if there's an issue in the small intestine and we're not able to properly absorb nutrients through the small intestinal barrier, that can definitely be a part of SIBO as well. Am I missing any big ones? Gas, I guess, coinciding with kind of like the bloating, gastritis.
Fiber intolerance.
Oh yeah, food intolerances.
A lot of food intolerances. So sometimes it's not just the fiber. It'll start to build, like you said, like a high histamine food. So where you start to react to almost every foods, that can be often signs. SIBO, like if it isn't addressed, it can make the food intolerances worse over time.
For sure. And that's like when we often get started with clients together, we'll look at bringing in some dietary changes just as a means of getting people some quick relief, right, from their symptoms. So whether that's looking at lowering or limiting FODMAPs in the diet, but like temporarily limiting high histamine foods temporarily, just to bring some heat off the body and find some relief from symptoms. We've definitely seen a lot of success with that in the early stages for clients.
Yeah. Those can be good temporary tools, but ultimately, remember, food is not the problem. And I know that can be hard with dealing with gallbladder issues. We tend to have food fear in general, and even post-surgery, sometimes that food fear remains. It's tough, right? We associate food with pain before surgery, and then it's still, in the case of where we're dealing with chronic digestive issues, it's still continuing the pain, and that's just not fun. So, of course, that can trigger some food fear. So we use the food as a temporary tool, but long-term, just keep in mind, food is never the problem, right? Usually there's other issues going on. So when there's chronic food intolerances, we have, certainly our dietary choices if we're eating processed foods, but if our digestive output's weak, if there's gut dysbiosis going on, what's the health of our liver? Your liver plays a big role with your digestive health too. All of these things have to come into play when it comes to a lot of food intolerances. So working with a lot of post-gallbladder surgery care, we see a lot of SIBO. We deal with a lot of histamine. Another one is bile acid diarrhea, and even sometimes I call it what do you call it? The perfect trio. What's not the perfect trio? It's like awful. It's bile
The not
reflux.
ideal trio.
Yeah. It's bile reflux and gastritis, or sometimes gastritis, bile acid diarrhea. They kind of often we see them coincide. And so it's very common with people like with bile reflux. They tend to have gastritis. And sometimes when we've done functional testing, typically I've seen them be SIBO positive and or H. pylori. So in individuals with gastritis, bile reflux, it's where you kind of want to uncover what could be causing the issues with this. These two together, the gastritis, bile reflux, is certainly really complicated. It's not something that I would suggest you navigate on your own. You're more than welcome to reach out to us at the Gallbladder Diet Team for support on this. But typically this does require more one-on-one care because it is complicated. As you know, if you're dealing with it, it's not fun. It's painful. And so again, there's different steps and you're looking at close to like 3 to 6 months to work on both. So yeah, typically where we see gastritis, bile reflux, again, we're kind of looking at what's going on in the body, what's stressing the body. Is there any factor that could be making the symptoms worse? So SIBO, H. pylori, poor digestive output, again, are certainly big drivers. Do you see any other factors, Mia, that could be causing
for like the gastritis and bile reflux symptoms?
Yeah.
Yeah, I mean, SIBO, any sort of like dysbiosis in the GI tract, particularly SIBO, causes a lot of, it's called intra-abdominal pressure. So a lot of pressure in the GI tract, which can like quite literally push up on the stomach and cause a lot of issues in the upper GI. Kind of with that poor digestive output picture, just to get more specific there, like that low stomach acid piece can definitely play a role. H. pylori, like you said. Valve or sphincter issues too, right? If there's issues with that lower esophageal sphincter, even a sphincter of Oddi, like if like pyloric sphincter and stuff, like if things just aren't working, if there's backflow anywhere, it can contribute to symptoms. Vagal tone, vagus nerve, chronic stress, like my brain always goes there too when I'm thinking of those symptoms as well. But yeah, testing definitely important, especially, I don't know, with chronic gastritis, like I always have concern for the health of the esophageal tissue, which is not equipped whatsoever to be dealing with like a constant onslaught of bile and stomach acid. So it's definitely worth like getting tested, whether that's like, we're always huge proponents of going to get scopes done, right? Like we're always like, go see your GI, get an endoscopy done, let's see what's going on here. And then the functional labs that we have access to can be very, very helpful and indicative as well.
Yeah, certainly. Yeah, we have a client right now where it's actually gone up to her teeth. So it's affecting her teeth quite significantly. And there's one tip that is so, so important if you have bile reflux gastritis that can help just give you a little bit of symptoms relief as you get started kind of navigating, finding a support team, is doing small, more frequent meals and ensuring that you're eating enough fiber. Because if there's an issue with bile, that fiber is your natural form of binder source. And doing the smaller, frequent meals helps keep that bile, or the food also acts as a natural binder, too, if you are dealing with excess bile. So anyone with bile reflux, I should say bile acid diarrhea, this is like, I can tell you this little minor tip is a game changer for most. And that's eating, close to every 2 to 3, if you have to do 2 hours initially, but moving it up to 3 hours and making sure all those meals are balanced with some form of protein, fiber from whatever fiber you can handle at the time, whatever fruits, vegetables you can handle, using supplemental fiber. So partially hydrolyzed Gorgum sun fiber, I tend to find works really well for people, especially with bile acid diarrhea that have more IBS-like response. It does have some prebiotics in it, so certainly start out small as you introduce it. So doing a combination of this fiber with acacia fiber. You can also try psyllium seed husk, and you can kind of play around with the different fiber supplementations, but ensuring that you get the fiber from the diet, whatever fruits, vegetables you can handle. As typically with individuals that have these issues, they have a lot of food intolerances. So we just got to work with what they can handle in the diet. But switching to that small, more frequent meals, again, you might have to start for 2 hours, move up to 3 hours ideally, and ensuring that they're balanced protein, you got the fiber, or using supplemental fiber, and certainly your healthy fats. Okay.
Especially for clients who suspect that you might have SIBO in conjunction with this like upper GI situation, PHGG, like the partially hydrolyzed guargone, I find to be quite well tolerated by people who suspect that they have SIBO. So if that's you, that might be like a good direction. And then don't discount too like meal hygiene, right? Like chewing properly, slowing down at meals, taking a couple deep belly breaths before meals can go a really long way in just supporting the digestive process in addition to like eating smaller, more frequent meals. So that can be really helpful as well.
Yes. And then obviously like supplementation. One thing I just want to note here is that this is where a lot of times people will tell you have to take ox bile without a gallbladder. And this is where these scenarios need to be individualized. So if you've been told you have to take ox bile and you're finding that it's making your bile reflux or bile acid diarrhea symptoms worse, this is your reminder that it's okay to not take ox bile without a gallbladder. There's many other ways you can support fat digestion. And in the situations of where it's making you more sick, then please, reach out to us. We'd be more than happy to help you because we see this all the time. But certainly, if it's not sitting well with your body's telling you it's not doing well, right? So there's many, many other ways that you can support and optimize your fat digestion, especially when you're dealing with more chronic symptoms. Sometimes even going in with herbal medicine initially is a nice approach to help support that.
Yeah, and it doesn't mean necessarily that you'll never be able to tolerate adding in bile salts or ox bile, right? Like sometimes we found that clients require some healing first, especially on like the bile acid reabsorption picture, and then maybe later if it's warranted, they can try introducing it. But yeah, there's so many options from the supplemental perspective.
Yeah. But both of these more complicated issues of bile reflux, bile acid diarrhea, these both can improve significantly. So if you're listening to this podcast and you feel stuck, you feel like your only options have been like PPIs or, taking bile binder medications, I can tell you, both of us can say, like from helping so many people post-gallbladder surgery, your diet, lifestyle choices, and as you work on the causes of these issues, it can help significantly. And you can see this sometimes turn around in a month, a couple weeks, especially with bile acid diarrhea clients, sometimes just from dietary change alone. So it's just really, really important to know that we do have some controllable factors we can work on to help support this. And you have many options outside of, taking bile binder medications, following a low-fat diet forever or low-fat diet forever. There's a lot you can do to help improve these two issues, if not reverse them.
Okay.
So I'm going to segue into one of more metabolic questions. So one of the number one questions I get asked on Instagram all the time is, if I remove my gallbladder, am I going to gain weight? Or I'm afraid to remove my gallbladder because I'm going to gain weight. Because of a lot of things that we're reading online on social media or even like Facebook groups. And certainly gallbladder surgery, just like it has some, just any surgery in general has side effects. And it's just unfortunate that we're not really educated properly on these. But gallbladder surgery does have potential metabolic and digestive consequences. Now, keep in mind this concern about weight gain post-gallbladder surgery can certainly be addressed if not prevented. And you could certainly lose weight. Where you read a lot of stories online, you have to always question, what is that person doing? What are they eating? What is their health history? Just because they're gaining weight does not mean you're going to gain weight. So just keep that in mind when you're reading things online. And when we see this issue of weight gain, there's many, many factors that we can work on. So we obviously have like our control. I always like to break things down on like controllable factors and more factors that require a little bit more digging into. So Mia, what do we see as like kind of the dietary lifestyle controllable factors that could be possibly causing some weight gain post-gallbladder surgery?
Yeah, so blood sugar.
Yeah.
Oh, sorry. I was just chatting over you. Getting so excited. Yeah, I mean, like from a dietary perspective, like blood sugar regulation is a big part of that. And part of that is hormonal, of course. Part of that is liver health, can play a big role, and gut health as well, actually can play a big role in what insulin is doing and blood sugar regulation and that kind of stuff. But we can have a massive impact on our blood sugar through our dietary choices and how we eat and our meal hygiene. And you were kind of alluding to that when you were chatting about doing the smaller meals for gastritis and upper GI, but making sure that you're doing a good protein source. Fiber is really supportive for kind of like dampening that glucose curve that we can see. So, and then getting like an appropriate amount of fats in, which is something that without a gallbladder may warrant like a little bit of playing with to see what your tolerance is. But there's lots that we can do from a dietary perspective, specifically as it relates to blood sugar. Apple cider vinegar is actually something that you and I use a lot with clients for various like reasons, I suppose, like even from a digestive health perspective, but for blood sugar too, can be really, really helpful. So if there's any insulin resistance, blood sugar issues going on that could be driving weight gain post-op, or in any situation, truly looking at how to support blood sugar and just like really dampening those glucose curves and not having that kind of like roller coaster is an important piece.
Yeah. And then certainly like other things within your control to start working on is like your stress. If, you know, you're chronically living in a rat race, and trust me, as a mom and business owner, I am susceptible to this all the time, but, you know, your stress and lack of sleep can certainly cause issues with weight gain. It's going to slow down your metabolism. You know, dietary, sedentary lifestyles. So if we're not exercising, obviously it's going to be hard for us to lose weight, especially as we age, our metabolism slows down. So typically when we see weight gain post-gallbladder surgery, a combination of low impact cardio and strength training is really great for this scenario to help improve insulin sensitivity, since insulin resistance is a big driver of weight gain post-surgery, and I'll chat about that. But I really like to suggest to clients to do like a combination of pure strength about 3 times a week. And then if you're able to walk on incline 30 to 60 minutes a day, that's a great type of exercise split that can really support weight loss and improve your metabolism post-gallbladder surgery without putting more stress on the body. So those are things like when we look at like your diet lifestyle that I would start checking off. Making sure that you're aligning with that, eating a well-balanced diet, health-promoting diet. We're not eating processed foods over, you know, whole foods, and ensuring that fiber intake, balancing your blood sugar, moving your body, work on stress, sleep. Now, let's say you've dialed in all of this, right? And you're like, Olivia, I already exercise, I eat healthy. We see this scenario all the time. Then certainly there's other factors that are contributing to our metabolic health post-gallbladder surgery. So why is it that gallbladder surgery is linked to things like weight gain or a metabolic syndrome or a fatty liver even? So any diseases that fall in this metabolic syndrome. So these are things that we have to take into consideration. So we know gallbladder surgery changes your bile composition. Okay, so we no longer have this bile stored. Bile is really important for fat digestion. So if we aren't optimizing bile well post-gallbladder surgery, we're going to struggle to digest and absorb our fats. And if you don't digest, absorb your fats well, it's going to be very hard for you to balance your blood sugar. So making sure that you're optimizing fat digestion is not about a foundation when we're working on insulin resistance or even blood sugar. Bile is also a form of detoxification. So if we aren't detoxing out, we're not going to the bathroom regularly, we're just storing all of this junk. And so we're going to store all this excess toxins, estrogens, hormones, cholesterol. And this can obviously have a significant impact on your liver, which is your fat burning organ. It's going to affect your thyroid. And if the thyroid is just dealing with toxin accumulation, this is going to slow everything down and all of your metabolism, right? The altered bile acid can also affect insulin sensitivity and fat metabolism. So in this situation, this is where a lot of the research shows the connection between gallbladder surgery, insulin resistance, fatty liver, is that, again, the change in bile is going to basically cause an issue with glucose and fat metabolism, and it's going to lead to an excess fat accumulation in the liver and promote fatty liver disease. When we have fatty liver, it's very hard. It's going to be more challenging to lose weight because your liver is your fat burning organ. It's really important for, glucose management. And so if there's any signs of potential early signs of fatty liver, or if your liver's struggling in general, then we're going to typically struggle with weight. Okay. So fatty liver post-gallbladder surgery is very common because of this. So sometimes people will be eating well, all this stuff, but then they get diagnosed with fatty liver, or they start to see changes with their glucose starting to rise, their cholesterol starting to rise. These can be early signs of fatty liver. And again, what happens is that scenario of bile, we're not breaking down our fats well. The bile is going to change our glucose and fat metabolism, and this is going to lead to fat buildup. And there is a lot of studies that show that post-gallbladder removal is that fat tissue in the liver actually shows that it's increased. And it's basically an accumulation of fat in the liver will affect your triglyceride metabolism, and this will increase the risk of fatty liver disease. And you can't talk about, obviously, weight gain without discussing insulin resistance. So insulin resistance is a big promoter of weight gain, of fatty liver issues, gallbladder issues. And so when there's insulin resistance present, your liver is going to take in more fatty acids from the bloodstream. And this increase in triglycerides, this is going to cause a type of liver fat or a type of fat that's produced. And you have combination of oxidative stress. This is going to promote a buildup of fat in the liver. Again, fatty liver, we have trouble with weight gain. Okay. And then certainly two other big factors when it's outside of diet is your gut microbiome. So, if there's issues with your digestive tract, with your gut in general, this can affect metabolic health and your hormones. We talked a little bit about how, if we deal with an increase in hormones, so you see this post-gallbladder surgery with estrogen dominance. So we're not detoxing properly because bile, again, is not supported after gallbladder surgery. And bile is a form of detox for excess estrogen. And if we aren't releasing out our bowels properly, we're dealing with an increase in estrogen dominant symptoms. This can promote weight gain. With your thyroid, same scenario, is there's many factors that can cause thyroid issues, but not digesting fats well, insulin resistance. We have issues with toxin accumulation post-surgery, so we're not detoxing properly. And that's going to slow down your thyroid. And when your thyroid's slow, it's going to slow down everything from your metabolic health to your digestive health. And at the hierarchy of all of this is your liver. So if you're struggling with weight gain issues post-gallbladder surgery, this is a sign that you really need to work on your liver health at the top down. It's really important. And when you learn to optimize your liver post-gallbladder surgery, it can start to really help support a lot of these issues.
I think too, one thing I'll add is if you are in this boat and you have had your gallbladder removed, maybe weight gain is a concern, even like the fatty liver health side of things, definitely if you haven't gotten a full thyroid panel done, we definitely recommend testing your thyroid. And that's something that we can even do if it's challenging for you to get through your primary care provider. Because thyroid's definitely a little bit of a chicken and an egg situation, right? Where, like you said, all of those factors can impact our thyroid function. But likewise, if you've been experiencing poor thyroid function, that could also drive, that could have been one of the root contributors to whatever gallbladder concerns you were struggling with that led to the removal. If it was dyskinesia, poor flow, sludge, stones, thyroid can definitely play a role. So it's definitely something we want to consider supporting as well.
Yep. And just to piggyback on the question about weight gain and everything, is that there was a question about navigating diabetes. So pre-diabetes, diabetes, post-gallbladder surgery. So gallbladder surgery does have that connection to metabolic syndrome. So connection between the two. So this goes back to our fat digestion, your liver playing a big role in managing glucose levels, especially when we have issues of diabetes or pre-diabetes. And if there is suspicion of fatty liver, this can interfere with this balance. We're seeing diabetes and insulin resistance. And the liver, it is important because it helps store and release glucose, but your liver can sometimes start overproducing glucose from, if it's just stress, from oxidative stress, inflammation, if, you're not detoxing well, if there's other issues of, what are some other things? Our diet. So like you see this sometimes in people post-gallbladder surgery. If we're eating too much sugar for our body to handle, if we're eating processed foods, but a big one is actually excess saturated fats. So sometimes people post-gallbladder surgery will start to overdo it on saturated fat consumption. So these are going to be your fatty protein, your dairies, butter, and your liver can't handle it, and it'll start to overproduce glucose, and this can lead to higher sugar levels, making diabetes kind of tougher to manage, which is hard because a lot of times, sometimes people will use keto for diabetes or pre-diabetic. But if your liver is having a hard time and it's not supported well as you go keto, then this is where you could see that sometimes increased risk of fatty liver to develop insulin resistance. So just be mindful about that if as you're working, navigating diabetes, pre-diabetes. Usually what I suggest in a scenario like this with most people is certainly use a continuous glucose monitor, because that's going to allow you to really see how your body responds to those complex carbs like the rice, potatoes, and, beets and things like that. You can also really see a snapshot of your blood sugar in real time all throughout the day, so you can better individualize your macronutrients. So in this case of navigating diabetes, pre-diabetes, post-gallbladder surgery, certainly I would say investing in a continuous glucose monitor, making sure you're eating blood sugar balancing meals that have protein, fiber, healthy fats, ensuring you're getting a lot of fiber intake, and then moving your body for at least 10 minutes after a meal, whether you're able to walk, get on a treadmill, or even just doing simple squats. That's something that just help to kind of flatten the curve. So we talked about some very common scenarios on today's podcast. I'm going to try to do more of these with Mia, but I did want to, there were a couple just kind of general questions about like foods to avoid, foods to prioritize without a gallbladder, how to support the liver post-gallbladder surgery. So let's just quickly kind of recap or just wrap up the podcast, Mia, and let's talk about some of that. So foods to avoid post-gallbladder surgery, I like to keep it simple, and certainly just, be mindful about eating whole foods over processed foods. So if you're eating a high consumption of processed foods, a lot of refined sugars, inflammatory oils, you're eating too many meals out, this is going to certainly cause a lot of inflammation. When you're gut sensitive, can lead to a hypersensitive gut, more GI issues. So at the foundation, you just want to eat more whole foods over processed foods. That's simple as it gets. And this can be really hard for some people initially, but try to focus in. If you are eating a lot of meals out, you're eating a lot of processed foods, focus on one meal at a time. So whether it's breakfast or lunch or dinner, prioritize that and start to move your way down. What would you say, what are some key things in the diet that they should focus on without a gallbladder? We'll kind of piggyback on this. Yeah, what are some things that they should focus primarily on in the diet without a gallbladder moving forward?
Yeah, definitely liver supportive foods is a big one, right? So we love to talk about incorporating better foods. Amino acids are also really important. So good quality protein sources are incredibly important for proper liver function. Again, we just want to, in many cases, steer clear of really fatty cuts in some cases. We probably don't want to go too hard on sausages and that kind of stuff in excess without a gallbladder, but good quality protein is really important for liver detoxification and to support liver function, like bitter foods. So your arugula, radicchio, endive, dandelion greens, even herbs. Like we love using bitter herbs in practice, whether it's through tea or tincture. In food sources, like dandelion root and milk thistle are really incredible additions. Green tea even for liver function. And then your brassicas, if you can tolerate them, in your allium family of veggies. So these are like your broccoli, cauliflower, asparagus, Brussels sprout family, and then your like onion, garlic family. Now, some people who, of course, may have SIBO, dysbiosis, food intolerances might not be able to tolerate those foods as well. So it'll definitely be personal to you and like whatever your food tolerance is if you're listening to this to support your liver. And then, yeah, fiber intake is really important. Again, a little bit of a Goldilocks situation with some people, right, where too much or too little may not pair well as far as bowel movements go, but definitely trying to get adequate fiber in, and whether that's through food sources or, like you said, leaning on supplemental forms. So whether that's incorporating some of that acacia or partially hydrolyzed guar gum, could be really supportive to incorporate as well. What else? I think too, like, I don't know, nutrients to support stomach acid production. We need a lot of minerals. I mean, we need minerals for truly everything, but I think of minerals for stomach acid production, insulin sensitivity, detoxification support. So getting like your sodium, potassium, your zinc in, that kind of stuff's important. In some cases, reducing histamine intake, like high histamine food intake, can be really helpful. Even just minimizing, like if you don't tolerate fermented foods can be really high in histamine. So like potentially playing with that. Any aged foods will be high in histamine. So think your like aged meats and really aged cheeses and that kind of stuff. So if you find those foods don't sit well or exacerbate symptoms, those might be something to consider in the interim, just like reducing and or avoiding. What else as far as like incorporating or things to focus on? Definitely like full foods, eating the rainbow, right? Like getting lots of antioxidants in is really important.
Yeah,
a
simple way is work on eating the rainbow for sure. Those are all really good key nutrients, and Mia made a point about a lot of them that they are key nutrients that really support the liver post-surgery, and that's really what is really important, that we continue to optimize our liver health without a gallbladder. So the only other thing I would add on to that is just ensuring that you're still eating a lot of blood sugar balancing meals. So making sure that you're eating balanced meals that have protein, fiber, carbohydrates, individualize that obviously, and healthy fats. So we're eating all 3 macronutrients. That's a simple way to balance your blood sugar post gallbladder surgery. Really support your liver too. Make sure it's an easy way to make sure that you're getting a variety of nutrients in the diet, especially if you're incorporating quite a bit of like 50 to 70% of fiber on your plate, like vegetables. That's an easy way to get a variety of nutrients. So when we talk about diet, it's simple post gallbladder surgery. I think we go around trying to chase what's the best diet post gallbladder surgery. And so I hope you take something from this podcast that it's actually quite more simple. Obviously, it will feel complicated if you're listening to this podcast and you're dealing with chronic digestive issues and you're like, Olivia, Mia, I can't eat that. Then certainly, yes, that's where we have to work on some other issues. But at the end of the day, when you look at nutrition at the foundation, it's based on whole foods. So if you're new to trying to figure it out, don't complicate it. Don't Google. Don't go on Facebook groups. Just start eating whole foods at home. Balance out your plates, proteins, carbs, fibers, and healthy fats. And that's a great thing to continue to focus on. And then certainly support your liver post-surgery. So Mia touched on a lot of key nutrients that are great for your liver. Ensuring your work on your bowels. So if there are issues with bowels post-surgery, if you're leaning constipated, that's going to put a lot of pressure on your liver, going to lead to toxin accumulation. So making sure that if you are constipated at the foundation, we can't push detox if you're backed up. So that goes back to supporting your liver is working on your bowels, ensuring that we have an exit plan of toxins. Work on fiber intake. Again, natural binding source for your liver, pulls the toxins out, and especially if you're having frequent bowels. Other tools that are helpful post-surgery are things like castor oil packs. That's an easy one to bring in. If you have bathtubs or doing Epsom salt baths or Epsom salt foot soaks, These are nice little gentle detox tools you can start to dabble in. And then work on the diet, moving your body, work on these foundational things, sleep, exercise. Your liver needs all of that. So making sure that you're working on these foundational habits first, especially if you're feeling overwhelmed and worried about supplements. The supplements don't stress about until you have these foundational habits in place first, and work on those. So we hope you enjoyed this Q&A little episode with Mia and myself. We hope it was informative, and we're looking forward to doing more in the future. If you are post-gallbladder surgery and you are dealing with chronic digestive issues or metabolic issues ever since gallbladder removal, and you need help navigating it, please reach out to the Gallbladder Diet Team. You can contact me, support@gallbladderdiet.com, or on Instagram, I'm mostly there, gallbladder.nutritionists, and we can send you different support options. Me and I would love to further help you. Working with so many people post-gallbladder surgery over the years, we know the ins and outs of gallbladder surgery care, and we love helping to transform your health. So please know that there are many, many options to help support you. You do not have to struggle with your chronic digestive issues, food intolerances, or metabolic challenges for years and years after surgery. There's a lot of tools that can help you, and we'd be more than happy to get you in the right direction and improve your health. So we thank you so much for listening to this podcast. Share it with a fellow gallbladder warrior that you think would be helpful. Send me feedback on Instagram. If you have any questions, requests for podcasts, we're always here. And thank you so much. And we hope you have a wonderful day. Thank you. Thanks, Mia.
Thanks, Olivia.
Bye, everyone.